Good morning, everybody. My name is Cynthia Davis, and I'm the President and CEO of Lakeridge Health. We're so excited to welcome you today to our Lakeridge Health Oshawa Hospital, one of our 5 hospitals located throughout the Durham Region, as we create a system of integrated care. We're honored today to welcome our guest, the Honourable Doug Ford, Premier of Ontario, Honourable Sylvia Jones, Deputy Premier of Ontario and Minister of Health, Honourable Peter Bethlenfalvy, MPP Pickering Uxbridge and Minister of Finance, Honourable Todd McCarthy, MPP Durham, Minister of Public and Business Delivery and Procurement, Patrice Barnes, MPP Ajax, Lauren Coe, MPP Whitby, John Henry, Chair of the Region of Durham, and Bob Chapman, Deputy Mayor of Oshawa. Welcome. I also want to acknowledge our Board Chair, Cordelia Clark-Julian, and members of our senior leadership team for their dedication and commitment. I also want to recognize our foundation CEOs for their continued support for Lakeridge Health. Before I proceed, I would like to take a moment to acknowledge the land which we are gathered on today, the traditional territories of the Mississauga of Sugog Island, and in recognition of the calls for action from the Truth and Reconciliation Commission, I want to affirm our organization's commitment to honoring the truth of our history and work together to build respectful relationships with our Indigenous people. At Lakeridge Health, we have a vision, one vision, best health. And every day we work tirelessly through our delivery of an integrated care system. Even during the most challenging times in our organization, I have been continued to be amazed by the extraordinary work that our dedicated team does. Our ability to deliver exceptional, connected care would not be possible without the continued support of the Ontario government. Thank you for your commitment, and thank you for helping us cultivate the healthy population for the entire Durham region. I would now like to introduce the Honourable Sylvia Jones, Deputy Premier, Minister of Health, to bring greetings on behalf of the province and to introduce the Premier.
Well, thank you, Cindy, and good morning, everyone. It is indeed wonderful to be back here alongside the Oshawa 4 and Premier Ford. You know, your local MPPs, Todd, Peter, Lauren, Patrice, are incredible advocates for the Durham region at Queen's Park, and I hope you know how hard they work for you in your community and at Queen's Park. I also want to thank the team at Lakeridge Health for hosting us today. The incredible work that you do every single day to make sure that you provide exceptional care for the people and families in Oshawa and indeed throughout the Durham region. And for your work in making today's exciting announcement possible. Under the leadership of Premier Ford, our government has been making record investments in healthcare right here in Durham and across Ontario. Through our Your Health plan, we are taking bold action and making innovative changes to build a healthcare system that lasts for decades, a system that provides you and your family with the right care in the right place, whether that be at your community pharmacy, primary care provider, or at your local hospital. To support our historic investments to expand primary care, our government has registered a record number of new nurses and new physicians in our healthcare workforce, adding new nursing and nurse practitioner education seats, and launching the largest medical school expansion in over 15 years, creating 2 new medical schools and 2 innovative partnerships, such as the first of its kind in Canada, Queen's Lakeridge Health MD Family Medicine Program. We are also continuing to support our hospital sector by investing more than $228 million this year, an increase of 10% over last year, to support critical infrastructure upgrades and repairs at 129 hospitals and 58 community healthcare facilities across Ontario, And through our most recent budget, we have also increased total base hospital funding by 4%, an unprecedented increase for the second year in a row. Today's announcement builds on the progress our government has achieved to better meet the needs of families in Durham and across Ontario, now and for decades to come, ensuring no matter where you live, you can connect to the care you need closer to home. Lakeridge Health provides care to over 700,000 residents at 5 hospital sites and 20 community health centres. And our government is ensuring Lakeridge can continue to meet the needs of Durham's growing population. Together, in Durham, we are getting it done. Thank you again to Lakeridge Health and all the incredible hospital and healthcare workers across Durham Region. Now, it is my pleasure to turn the podium over to Premier Ford, who, without his leadership, none of this would be possible. Thank you, and stay well.
Well, good morning, everyone. What a great day for Durham healthcare and Durham right across the board. And thank you, Sylvia, for that introduction. I have to tell you, I'm blessed to have a person like Sylvia as my Deputy Premier and Minister of Health. You're doing an incredible job. And I'm thrilled to be back here in the beautiful city of Oshawa. And Bob, the Deputy Mayor, thank you for having us by, and all your local members here as well. I call the local members the Durham Four, as you've ever heard, and it's headed up by a great Minister of Finance, Minister Bethan Falvey. I call him Moneybags because he's the guy that controls all the money. Minister McCarthy and MPPs Lauren Coe and Patrice Barnes. I also want to acknowledge, as I mentioned earlier, Deputy Mayor Bob Chapman and Regional Chair Henry. Chair, you've done an incredible job being the chair for a number of years, and thank you so much for all your support. And all the hospital foundation CEOs, including Eves from Lakeridge Health Foundation, Tracy from Ajax Pickering, Rachel from Port Perry, and Maria from Bowmanville. And finally, I want to give a big thank you to Cordelia. Cordelia, come here for a minute. Cordelia, you're hiding over. Don't be shy. Come on. Just say, give a good wave there. So, Cordelia, everyone tells me what an incredible job she does. She's an absolute champion. Keep going. The chair, you're amazing. Thank you. Thank you so much for everything. She's the best. And Cindy, thank you. And you're doing an incredible job, Cindy. Thank you for everything you do. And Dr. Wax and the entire team at Lakeridge Health for hosting us today. And for all the great work you do to keep the people of Durham healthy. As everyone in this room knows, Durham Region is growing at a rapid pace. In fact, it's one of the fastest growing communities in the entire country, with the population expected to double by 2041. Just think of that, double the size. As we welcome more people, as the area's economy grows, and it's growing, we need to make sure our infrastructure keeps up. That's why we're working closely with all the mayors in the region as well as the region itself and across the province to build more homes and bring more home ownership into reach for more people. We're refurbishing the Pickering nuclear plant to help meet the increasing demand for clean electricity. We're expanding and improving the region's transportation infrastructure. We remove the unfair tolls on Highways 412 and 418, and work is underway to expand Highway 7 from Pickering to Markham. And by the way, thank you, Peter, because I was out there at a new development, a massive development out there, and Highway 7, as anyone in Durham Region knows, and I know you know that as well, Chair and Bob, but it's jam-packed. So through Peter's leadership, we're widening that, and that's going to be really exciting. And Highway 401 starting at Brock Road. We've increased weekend GO train service, and we're investing $730 million to extend the Lakeshore East Line into Bowmanville. And we're making record investments in healthcare, including additional funding for mental health care and more than $12 million in capital planning grants as the first step to support Lakeridge Health's master redevelopment plan. And that redevelopment plan is incredible. Again, I want to thank the team for putting that together. But we know when it comes to healthcare, there's more work to be done. I always say it's continuous improvement. So today, I'm thrilled to announce that our government is building and expanding health infrastructure across Durham. This expansion is part of an integrated and truly regional plan to provide people in Durham with more connected and convenient care. Our government has already approved the Bowmanville site redevelopment plan to double the hospital's capacity with more beds and expanded inpatient and ambulatory care services. In addition, we're going to build a new Whitby hospital. So Lauren, thank you, because Lauren, you're the biggest advocate when it comes to the Whitby hospital, to improve access to fast and convenient care. We're going to expand inpatient acute care in Oshawa and build a new post-acute care center in Pickering to connect more patients and their families to rehabilitation and recovery supports. And going forward in the future phases of this multi-phase plan, we're going to look at expanding care at the Ajax Pickering Hospital. And Patrice, thank you for your advocacy on that as well. This expansion, these investments are going to add an additional 300 hospital beds across Durham Region. It will create a more connected and resilient healthcare system, ensuring people in Bowmanville, Oshawa, Whitby, Ajax, and Pickering have access to the care they need and the services they need for decades to come. Friends, right across this province, we're investing record amounts to shorten wait times and strengthen our healthcare system. Over the next 10 years, we're providing over $50 billion to support more than 50 hospital projects. We're strengthening our healthcare workforce with more than 12,500 new doctors and 80,000 new nurses. We have 30,000 nurses in our colleges and universities just waiting to graduate and come into the healthcare system. We're investing $546 million to connect 600,000 more people to primary care teams. We've expanded home care and paramedicine services, added new urgent care centers and pediatric clinics, and have empowered pharmacists to treat and prescribe medications for the most common ailments. And this is a great one. Over 1 million people have utilized that and went into their pharmacists. And together, these investments are ensuring that residents of Durham Region, that people across the province have access to the care they need when they need it closer to home. Once again, thank you to the incredible team here at Lakeridge Health for hosting us today. Thank you all for joining us, and may God bless our healthcare workers, and may God bless the people of Ontario. Thank you. Thank you.
We will now open the floor for questions from the media. Please come to the mic and state your name and outlet. Just a reminder, the format is one question and one follow-up. First question.
Tim Kelly from Metroland Media.
Hey, Jim, how are you doing?
Good.
Good.
So, Premier Ford, I want to be sure I understand this correctly. Are you saying that you've now made a commitment, this is a promise, that there is a hospital being built in Whitby, there is a planning grant that has been approved for $3 million, and has the planning grant been approved? Is it going forward, and is it now been signed off on?
The answer is yes, but we're looking at this as Durham healthcare altogether, right across the board. And I'm going to pass this over to the Minister of Health here.
Yeah, the announcement today absolutely says that we are building, with Lakeridge Health, a hospital in Whitby. Congratulations. It speaks to the advocacy of the Durham Four. It speaks to the leadership of the Lakeridge Board to look at this in a regional approach to make sure that we are putting together healthcare assets that are going to be sufficient for the entire Durham region. But yes, the Whitby Hospital is going to be built.
Just a quick follow-up. Do we have any sense of timelines on this, capacity for the hospital? I mean, those may be questions that are a little more detailed, but any idea about that?
Yeah, so the board chair and Cindy and I were talking previously before the announcement, and now the exciting peace happens, the community consultation stage will begin, and we anticipate that we will be able to work very closely with Lakeridge Health and get this hospital operational in the next 10 years. But I'm happy to turn it over for more details to Cindy.
Thank you, Minister. So we're really excited about the announcement today. The funding that's been directed to Lakeridge Health really is about building that connected care integrated system. So you will hear that not only will we be able to move forward with the planning for the hospital in Whitby, but we'll also have an opportunity to look more broadly throughout the Durham region, particularly in some of the gaps that we see related to complex continuing care and rehab. So just a really exciting day. I want to take the opportunity again to thank not only the Premier and the Minister, but everybody, particularly the Durham 4 and our elected officials. They have worked tirelessly, not only for their own riding, but also for the entire Durham community. We're really excited about what our future looks like, and we have a lot of people to be thankful for.
Yeah, Cindy, you nailed it. You know, we call them the Durham 4, but they all work collaboratively together. They look at, you know, not just the Pickering, Ajax, and Oshawa, and Bowmanville, and Whitby, but they look at it as Durham as a whole, and every decision caucus makes, it's based on making sure they're consulting with us, and we move forward with it. No one understands their community better than the Durham 4.
Good morning, Premier. It's Jessica from the Trillium. So we've been hearing from the heads of children's aid societies and from child welfare workers that more and more children are entering the system not because of abuse or neglect at home, but because they have high developmental or mental health needs that their parents can't get adequate support for in the community. I wanted to know if this is acceptable to you, that more and more parents are turning over their kids to the system as a measure of last resort.
Yeah, it's very unfortunate that that's happening, but we're pouring money into that. In the last measurement that I've seen, I'm really focused on that Ottawa where they had the strike. Now they're finished the strike, but we're putting $17 million more, and half the amount of kids are going in there. I've asked the minister, I've directed him, I want a full audit of the whole system, and we're going to see where some of the holes are there. But they're going to be well on their way with a complete audit of the entire system. And last time that happened, we saw there was a lot of areas of improvement, let's say.
So the people that we've spoken with have called for an all-of-government solution to the problem where it's just not one minister who takes ownership for it, and you have had a lot of social services minister over the years. So is that something that you guys are able to contemplate, sharing that responsibility, and how high is this generally on your radar?
Well, how high is on my radar? I probably get 10 to 15 calls a day on it, so on my cell phone. And anything that we do it as a collective group, and where we need to get other ministries involved, we don't hesitate to get other ministries involved. But we're going to do a complete audit of the entire system, because I feel we have some issues there.
Good morning, Mr. Premier. Jamie with
Jamie.
CTV. This question comes in from Robert Benzie, Toronto Star. And he's King's Counsel. Last summer, you promised to fix the system over the concerns of patronage and the appointments of the lawyers to the King's Counsel. Since July last year, was 91 people were appointed to the King's Counsel, but nothing since. Where are you in fixing the King's Counsel?
Boy, I thought my buddy Robert would give up on this. He's been on this like a dog on a bone. Tell you the truth, people don't give two hoots if they have KC behind their names. The average person, they're worried about health care that we're announcing today. They're worried about affordability and the economy and crime. They don't care about this KC beside their name. So maybe he needs to look for another story.
But
it's kind of a nothing story, to be very frank with you.
Is there not there was controversy with their patronage and the appointments?
I wouldn't say that, Jamie. You know, there's people, it's like QC, Queen's Counsel before. Someone does work for the government, they get Casey. They aren't getting any more money. They aren't doing anything. It's just something behind their name.
Thank you, Mr. Premier.
Say hello to Benzie.
Thank you.
Here's Siobhan Morris from CTV News.
Hi, Siobhan.
Will you be realigning the provincial riding boundaries to
No.
match the... No. You didn't
No.
even let me get it out. Can you explain why?
Because why change something that works? It works. So it's all good. Just because the feds want to do it, jury rig the ridings, and it's no secret. People do that. Governments do that. I'm not doing it. I'm going to leave the boundaries alone, and people will decide if they want to move forward with our government on prosperity, on health care, on the economy, or they want to go backwards and vote for the other guys. They'll have that choice.
Is there a consideration there about keeping a lid on spending, adding more members to the House? Is that a concern for you?
No, we're just leaving it alone. We just aren't touching the boundaries. Less politicians, the better it is. Yeah.
This concludes the questions for today. Thank you for joining
Not quick.
us.
That's just getting warmed up. Anyways, yeah, so anyways, folks, thank you again. Great day for Durham Health, and I just want to thank everyone involved, Lakeridge and the Durham Floor and the chair. So way to go. God bless you, and can't wait to turn the dirt over or cut the ribbon as well. Thank you.